Hello, I am Jill Todd. I am a doctor of veterinary medicine. I am certified in veterinary acupuncture as well as veterinary chiropractitioner. Also certified in advanced cold laser therapy. And today what we're going to do is we're going to learn about Bladder Meridian touch. And this we're going to use to help introduce a new dog into the household, to help dogs who have some fear, some aggression, anxiety. It will help with confidence, courage, PTSD, and it's just a great bonding thing, especially with a new dog. It's good for your older dogs who have issues with their back as well. So this is just a lovely thing to learn that you can use in your household every day. The first thing we want to do is introduce olive oil, and I want to make sure she's accepting to me to do my therapy. She's a lovely dog that I adopted a few months ago, so she does have some issues with just where her place is in the household right now, as well as some back issues. So she's got some pain, things that we're going to explore and find during our Meridian training. So what I'm going to do, the bladder meridian goes from the eyes the whole way down this dorsal spine, through the back of the foot down to the pinky toe. We're going to start at the eyes, and we're just going to gently sweep the eyes. Some dogs aren't really fond of their eyes, so if they start to blink or move away, just go back and use the back of the head. She's liking this. We're going to go through the back of the head and touch the neck, and I can feel right through here she's got some tension. So note to self, a little tension over the neck, and then we're going to go down back through the withers. At this point, the bladder meridian goes to two spots on both sides of the dorsal spinal process. Because she's on her right side, it's a little difficult to get all that, but I'm going to sweep underneath here. We're going to come down and do both sides of her legs, and she's liking this. She's giving me a nice stretch down through that pinky toe, and then also just down through the tail. So note, when we did that, the tension on the neck, which we already talked about, and then right over this pelvic area, she's got a little bit of pain and issue, and she got a little bit uncomfortable. So we're going to definitely put and spend a little time there. But what we want to do is make sure that she's comfortable with everything, and she appears to be very comfortable. She's stretching out and just getting nice and relaxed. So let's do that sweep one more time. We're going to go up over the eyes, the back of the head, down the back of the neck, both sides of the spine, down the buttocks, the outside of the legs to the pinky toes, and then also don't forget Mr. Tail. One more time. So we're going to do 3 bladder meridian sweeps to just get this area warmed up, to open up the channels, and to try and get rid of some of these toxins. And now what we're going to do is go back here, and I'm going to concentrate on her pelvis, because that's where she has the most pain, because she's an older female. That's also an area in the chakra number 2, which has to do a lot with confidence and power and power struggles amongst the household. So really concentrating on this area will help with pain as well as some of her emotions. She seems to be relaxing into it. There's a little bit of tension here you can feel. I don't know if you can see it on the camera because it's pretty subtle, but we're going to just do a little bit more massage or touch therapy, and then I'm going to go back up here and start on her eyes again, and then work just on her neck, just a nice gentle touch, which is what she likes. Sometimes with the neck, when it's really stiff, you can even use a little bit firmer touch, almost a massage. So you can massage and then sweep down. Doing the bladder training or the bladder meridian touch is something that you can do in your household every day, which is lovely if you have the time. If you don't, you can certainly pick maybe a couple times a week to really help, especially, like I said, if you have a new dog, if you've got some struggling powers amongst other dogs, especially an older dog. As they're getting a lot older, there's always arthritis over the back and hips and neck. So just opening up these channels, especially in the winter when it's cold, is just so lovely to give them this type of movement and therapy, a little bit of touch and love. And she's eating it up. So let's go back up here to the neck again, and I'm going to just put a little bit more pressure on there and see what happens. And run right back down And let's work on this pelvic girdle a little bit too. I'm going to put a little bit more pressure on there. And then we're going to sweep down. Always forever sweeping the hind limbs and the tail. And some dogs can be a little bit possessive about their tail, especially if they've had some injuries in the past. So she was just a little bit concerned about that. So we'll just back off there and go back up over her head. Many times, if dogs get a little bit worried, you can massage around the back of the ears, massage around the back of the neck, let her get relaxed again. And then you can start to focus on the areas where there's pain, because if it's just a little bit too painful, she's trying to tell you something. So you have to listen. You have to look, listen, feel. I like to look at the dog's eyes, or horse or cat, whatever animal you might be working on, and seeing if they're focusing on you, what their expression is. Do they feel like they're happy? Do they feel like they're doing something and they're not really sure? She seems to be in a pretty good place. So we're going to go back up here. And we're going to get the eyes one more time, over the back of the head, over the back of the neck. She's starting to get a little bit sleepier. Down over the withers. Remember the 2 branches on both sides. She's a little worried right here. She did that the last time too, in her mid-thoracic. So let's concentrate on that just a little bit if she'll let me. I'm going to back off on the touch a little. Just do nice and soft. We're going to do both sides. And I can see her eyes are softening again. And that's a good thing. That means she's allowing that. She was a little worried about it at first. And then we're going to sweep over the pelvis, down the hind limbs, down the tail, back of the neck, down the back of the withers, both sides. Because she has a ridge, it's really nice because you can just feel where those dorsal spinal processes are. She's going to sit up now, so let's see, maybe she wants a little bit more work on her neck. Is that what you want, Miss Olive? Yeah, good girl. And always talking to them gently and letting them know how much you love them. You going to reposition here? What do you want? Oh, you want this side now. Isn't that wonderful how she presented to me what she wants? Our dogs do speak to us. Sometimes we just have to listen. Go down the neck, down both sides of the ridge, down the legs. We're going to concentrate on this area where she was a little bit tender before. Always sweeping down the neck, down the back, down the neck, down the back. That is a good girl, Olive. What do you think, huh? Yeah, was that a little yawn? It's always nice to see a little yawn, a little chewing, just a little bit of relaxation. We're hoping to help her with her transition into the new household. We're hoping to help her with some of her arthritis and issues of pain over her neck and over her pelvis. We want to help her with any kind of PTSD from her former life that she had with another place. And we want her to just know that she's loved and welcome. The acupuncture points that go with the bladder meridian are so easily accessible because they are on the back of the head, the neck, the spine. So it's a nice way. If there's no other meridian that you ever learn, the bladder meridian is obviously one of my favorites. It's one of the best for acupuncture, but you can do the acupressure at home and you can just give your dog as much love as she needs. We're going to do some more of this. We're going to do some more meridians in the future. But right now I just wanted to give this gift to you because the bladder meridian is obviously my favorite. Thank you.